Why is the eye chart hard to read during a test? Have you ever wondered why reading an eye chart during a visual acuity test can be so challenging? There are several reasons that relate to both the design of the chart and individual eye health. Let's explore this topic together. First, consider the letters on the chart. Some of them look quite similar, especially when they are small. For instance, letters like B and E or F and P can easily be confused. This is particularly true for individuals with conditions like amblyopia, often known as lazy eye, where visual clarity is compromised. Next, let's talk about the crowding effect. This phenomenon occurs when letters are placed closely together. Letters in the middle of a line can be harder to identify than those at the beginning or end. This effect can be especially pronounced in people with visual impairments, such as those with macular degeneration, where central vision is affected. Now, while the eye chart primarily tests visual acuity, it does not assess other essential visual skills. For example, eye movement control and focusing ability are not evaluated during this test. Individuals with glaucoma may experience reduced contrast sensitivity, making it difficult to distinguish letters even if their basic visual acuity seems normal. Patient-related factors also play a significant role. The test requires patients to recognize and communicate letters accurately. Children or individuals with cognitive impairments might find this particularly challenging. Additionally, fatigue and attention can wane during the test, especially as the letters get smaller. Lighting conditions and pupil size can also impact how clearly the chart appears. Poor lighting or changes in pupil size can reduce the clarity of the letters on the retina, making them harder to read. Furthermore, the eye chart itself has limitations. The commonly used Snellen chart measures the ability to identify high-contrast letters at a fixed distance. However, it does not detect other visual problems, such as contrast sensitivity loss or peripheral vision defects, which can be present in conditions like glaucoma or macular degeneration. Speaking of eye diseases, they can significantly affect how we perceive the chart. For instance, glaucoma can damage the optic nerve, leading to peripheral vision loss. While this may not directly affect the ability to read the chart, it can impair overall visual function. Macular degeneration impacts the central retina, causing blurred or distorted vision, making it difficult to discern letters even if peripheral vision remains intact. Eye care professionals take all these factors into account when interpreting a patient's difficulty reading the chart. If someone struggles, further testing may be necessary to assess overall eye health. This could include tests for glaucoma, macular degeneration, and other visual function assessments beyond just acuity. In summary, reading the eye chart can be hard due to letter similarities, the crowding effect, limitations of the test itself, patient cooperation, and the presence of eye diseases that affect vision quality. Understanding these factors helps eye care professionals diagnose and manage vision problems effectively. If you find the chart looks fuzzy or confusing, it is important to communicate this to your care provider for an accurate assessment of your vision.